Hi, my name is Caroline Arndt, and I'm going to be discussing the case of KM. She is a female of unknown age who presents to the clinic for a routine checkup. Her last physical exam was at age 15. She reports no significant medical or surgical history. She has no known allergies, and her only medication is orthotricycline. This is her sole form of contraception. She denies using condoms. She reports being sexually active with her boyfriend of 6 months, who she currently lives with. Her last menstrual period was 2 weeks ago, and she receives pelvic exams yearly. She states that she feels tired most of the time. She reports a strained relationship with her current boyfriend. She reports feeling pressured to have sex with her current boyfriend, and her parents divorced when she was 10. Her father suffers from alcoholism. Both parents live 100 miles away, and she cannot afford to call her mother due to long-distance charges. Her brother is away at college. Prior to their divorce, KM says her mother was slapped around by her father when he drank. She is a high school graduate working full-time as a waitress, and reports she has recently missed work due to personal reasons. Her significant other is a 17-year-old high school dropout who works at a car wash. She states they argue about money frequently, and he does not participate in helping around the house. She states he is jealous and discourages her from talking to her friends and will show up at her job randomly to check up on her. She states that he drinks a 6-pack daily and becomes mean when he drinks. She denies physical abuse. She currently smokes cigarettes to relieve stress, and she desires to go to college but states her boyfriend thinks it is a waste of time. She denies exercise, denies eating breakfast, and she consumes a diet of mainly high-fat fast foods and increased caffeine intake. She denies any suicidal or homicidal ideations. Her physical exam, her vital signs were blood pressure 120/80, pulse 80, respirations 20, and temperature 98.6. They were within normal limits. She is thin, and her general appearance is appropriate for her age. She has no ecchymosis present or any lacerations, any other signs of physical trauma. She is alert and oriented, nails are neatly trimmed, so she has no signs of poor or decreased personal hygiene, but she does maintain poor eye contact throughout the interview. Her lungs are clear to auscultation. Diagnostics, the Beck Self-Report Depression Scale is negative. Her baseline labs, which were her electrolytes, liver function test, renal function, cholesterol, were all within normal limits. As far as her assessment and plan, she is a female who presented for a routine checkup, and during this checkup, she revealed some alarming social issues, such as feeling sexually pressured and isolated from friends by her boyfriend, along with smoking as a means to relieve stress, as well as poor dietary habits. My first differential diagnosis and my highest concern would be domestic violence. Her interview signifies that she is a victim of sexual abuse and also current verbal and emotional abuse. She states her boyfriend is jealous of her friends, forces her to have sex when she doesn't want to, and he does not want her to pursue a college education. She also states he becomes mean when he drinks, which is every day. So for this, I would offer intimate partner violence resources, such as contact information for the National Domestic Violence Hotline and website. I would also discuss options, information about legal tools and community resources, such as women's shelters and support groups. I would also like to discuss and promote safety planning and maybe set up a plan if things ever escalate or if she ever decides that she's ready to leave the relationship. I would place a social work referral and provide a crisis number if she does begin to have feelings of self-harm, and I would also offer resources for counseling. I'm also concerned for her to have a risk for depression. She maintained poor eye contact throughout the interview. She also expressed feelings of hopelessness in her relationship, and she has also been missing work. She also has a very decreased support system due to her boyfriend not wanting her to see her friends and also the distance between her and her family. She does deny suicidal thoughts, and her Beck self-report depression scale was normal, but she still shows some alarming signs that could lead towards depression. So I would provide a crisis number in case the patient does begin to have these feelings of self-harm. And I would also provide resources for counseling. Another concern I have is nicotine dependence. And this one is not as pressing as the first two issues that we discussed, but I would still offer smoking cessation education and resources. And the last would be her poor dietary habits, and I would discuss her diet and ways to improve her diet as far as education regarding nutrition, the benefits of eating healthy, and the importance of staying hydrated, as well as education on health maintenance such as stress management and alternatives to smoking such as exercise. Finally, I would like to make sure we set a follow-up appointment and make sure that she has proper access to the follow-up appointment, such as transportation, and that's it.